And so I know I've done it. I think every American has done it. You are worried about the price tag, and so you don't go in. Whether it's emergency room, whether obviously if it's something life or death, you got to get it taken care of, or it's something in crazy pain. But if it's something that can be, you can maybe get over it, or you even think that you have the chance that okay, I'll get better after a few days. You're delaying that, like you were saying. And so with your facility, if someone comes in, obviously you want to try to schedule an appointment, right? But if they have to come in, either way, they're spent. I think you said $25 was the cost of the service.
That's right. It's $25 a visit. And so you know that on the front end. You don't you might not know what you're going to be diagnosed with and what the cost on the what the additional cost could be as far as medications. And we work with our local pharmacies to try to get reduced rate. We always focus on generic drugs. We help our patients find the cheapest alternative when a drug is needed. But here is $25 and anything else that it's going to cost you. We're going to tell you up front what that cost is going to look like or what we assume it will be so that you know in advance. But to know that you're walking in and it could only cost you $25 plus whatever medication, if labs need to be run, what that's going to be. It's nice to know that you can get in and out for that amount. Whereas when you have insurance, you typically know your copay, but sometimes those copays are really high. And so being able to know $25 is your amount to enter the facility is really it's a good thing to know. And if someone is really having some severe challenges with their financial situation, we're going to do our best to work with them because we want them to be seen. If they're coming in and they need that care, we want to make sure that we're taking care of them.
Yeah, there's no way someone should not be seen for even if it's a financial situation. So yeah, that's great that you work with them on that. And like you said, it's just great to get this out there. And so hopefully many people in the community can see this episode. And that's why I was trying to dig into the pricing a little bit more to kind of give them a little more transparency.
Yep, absolutely. I think that's really important in healthcare transparency and what things are going to cost you. It's one of the few services that you get that you don't have that information.
Oh yeah, definitely. Well, Michelle, we're going to cut to a quick commercial break and then we will be right back. All right. And we're back to our episode of NEA Impact Giving Back. We're here with Michelle Lady. She is the executive director of Jonesboro Church Health Center. Michelle, again, thanks for joining us, and we'll jump into our next segment here.
Well, I'm really thrilled to be here to talk about the Jonesboro Church Health Center and the volunteers and the community that supports us.
Yeah, and that's great. And that's what this show is all about. We want to really put it out there of what's going on, how each organization and company and leaders are helping the community and giving back. And so that's why we have it right in the name of the episode of the show. And so one thing I do want to know is outside of the healthcare facility, how is Jonesboro Church Health Center helping or trying to make a difference in the community?
Well, we have a very singular focus. Our mission is to provide low cost, high quality health care to any individuals, any adults living in the Northeast Arkansas area that don't have insurance. But we also impact the community by providing volunteer opportunities for individuals who want to serve and do something. You don't have to be a medical professional to come and volunteer with us. We have individuals who do many things to support us. We have volunteers who serve on our board of directors that meet monthly to oversee the work that goes on at the health center. And then we have businesses that support us by giving their time, talent, and treasure to, make an impact on the work that we're doing. Our biggest fundraiser of the year is going on right now, and I'd love to tell you about it.
Yeah, yeah, sure. We'd love to hear about it.